Speaking of ultrasounds in an IVF treatment, what is involved in an IVF monitoring ultrasound?
So IVF monitoring ultrasound scan. So we do two types of monitoring ultrasound scan in IVF, which is for fresh cycle when you are doing ovarian stimulation, and second is for frozen embryo transfer cycle. The purpose of these monitoring scans are different. In fresh IVF cycle, when you have a menstrual period and start ovarian stimulation with the FSH hormones, so in IVF ultrasound scan or IVF monitoring overall, we need to ensure couple of things. One, we need to know how your ovary is responding to stimulation. Second, we need to make sure that you haven't ovulated by the time you reach the egg collection. So for that, ultrasound scan generally can be started from day 7, day 8. So, and on ultrasound scan, very systematically, sonographer measures each and every follicle on the ovary. So mainly we are here interested on ovaries. Yes, at the same time we scan the uterus, but mainly here we're interested in ovaries. We count each and every single follicle on the ovaries and the size of those follicles. That tells us how your ovary is responding to stimulation. Any follicle which measures less than 1 centimeter is called antral follicle. This follicle is there, but it's not been activated. It's not going into the growth phase of your follicle development. So any follicle bigger than 10 centimeters, 10 millimeters, 1 centimeter, is already activated. That's growing follicle, which is potentially can become mature and can give you egg. So we need to count how many follicles, all follicles, small and big, antral follicles and growing follicles. All follicle sizes should be measured and then we plot on the chart. So on the right and left ovary. So that helps us to understand how many follicles got activated after stimulation hormones, FSH hormones. And then we need to decide whether these follicles are big enough for triggering or not. And also we need to decide whether we should increase the dose of FSH if the follicle is not getting activated, or reduce the dose of FSH, and or stop the FSH altogether before we trigger. So that's very, very critical for us to know exact size of follicles and how many follicles are growing and how many follicles are antral follicles which are not growing on both right and left. That's a follicle, it's called folliculogram scan, which means we are scanning to check follicle sizes and number of follicles. And at the same time, the sonographer during IVF monitoring, fresh IVF cycles, they check the uterine again size, the uterine contour, because if some pathology was there which wasn't detected in initial fertility baseline scan, we want to pick up. So let us say adenomyosis, for example, it may get undiagnosed during initial ultrasound scan. During monitoring, we screen for adenomyosis. We check if there are any signs of adenomyosis like Venetian blind sign and shadowing, subendometrial buds, or myometrial cysts. If we pick up, then usually the fertility specialist gets notified then so that we can make a very individualized plan. So also if there's any uterine fibroids, that those fibroids get assessed, and endometrial polyps, if there is endometrial polyp that gets assessed. And most importantly, especially if you're planning to do fresh embryo transfer, we want to check the endometrium. Endometrium, you will check by checking endometrial thickness and the character of endometrium. For example, to rule out Asherman syndrome, we need to check if there's any adhesions inside the endometrium or echogenic lines or any fluid inside the endometrium. So especially in patients doing fresh transfer, we need to make sure the endometrium is optimal. And the endometrium generally we want to be more than 7 millimeters without any fluid, without any interrupted lines, so that we can do a fresh embryo transfer. So, so yes, ovaries get assessed for follicle sizes and numbers. Uterus get assessed to exclude any adenomyosis or uterine fibroids. Endometrium gets assessed to exclude endometrial polyps and endometrial pathologies or any sign of Asherman syndrome, and also we assess endometrial thickness in fresh IVF cycle when we are doing ovarian stimulation. In frozen embryo transfer cycle, we want to, if we are doing natural cycle, stimulated, natural, modified natural, or letrozole natural, or just simple natural cycle, we want to make sure that there is a follicle growing and the ovulation is happening. So, and we use hormonal tests to make sure that this synchronous follicle growth is happening and ovulation is going to happen. And also we check endometrium again. So you try and uterus, like muscle, like to rule out adenomyosis and fibroids, and endometrium as well. So monitoring scans are not as thorough as other scans like the deep pelvic ultrasound scanning or baseline fertility scanning, but again, each scan we take it as opportunity to screen for any pathologies which might not have been detected in previous ultrasound scans.